Okay. Hey everyone, my name is Alyza and I'm one of the physios who work at Embodied. Today I thought I would chat to you a little bit about the first appointment following sustaining a concussion, either out of the sporting field, in the sporting field, at home, or just hanging around with your mates. So last week, if you had watched our live video, you would have heard Clara talk about the pathophysiology of a concussion, how people sustain concussions, and the fact that concussion doesn't always occur with a loss of consciousness. So today, I wanted to run you through what to expect in your initial appointment after sustaining a concussion and what the physios will kind of do to help guide you through your rehabilitation immediately following your injury. So, as you might all know, we are a certified clinic with complete concussion management. Three of us, Suzanne, myself, and Clara, have all completed our training for management and assessment of concussion, for baseline testing for sporting teams, and for management and assessment of post-concussion syndrome. So I'm going to go through the first appointment following an acute concussion, and we'll run you through exactly what to expect and what we might do to help manage. So for an acute concussion, it's very important that you get in to see someone who is trained in assessing concussions as soon as possible. So within the first 24 hours is ideal, so like the next day. And we book in for an extended appointment just so that we can really run through history, clear any red flags, and give you a proper diagnosis. So when you first pop into the clinic, we'll set you up with our complete concussion database, and from there we'll give you a couple of questions just about your injury history, asking about how many concussions you might have sustained in the past, and what your symptoms and experience is like following this concussion. So exactly how it's affecting you, are you getting headaches, that kind of thing. We will also kind of get a ballpark about what kind of activities make you feel a little bit worse. So have you been going to school and you've been getting really bad headaches because you've been at school, or have you been staying home and you feel fine? That kind of thing. We also use this appointment to rule out any red flags. So we will go through testing of all of your cranial nerves. We look for any damage to central or peripheral neural systems that haven't been picked up on scans if you haven't had a scan. And we also look at whether you've been going to school, going to work, or whether you've been driving, any exercise, and that kind of thing. We also like to look at your nerve testing. So we look at the strength and power in your upper and lower limbs, as well as sensation and reflexes, and we get a general idea of how it's kind of impacting you on the day. From there, we will generally have a quick screen of your neck, because you can't have a concussion without also having a whiplash injury. So we'll check in on your neck and make sure, just to kind of see whether some of the symptoms are coming from your neck. We'll also, if we have time, do a quick screen of your vestibular system, but we tend to leave this until later on. So this appointment generally lasts 45 minutes to an hour, and from then what we will go through is a lot of education. So we look at putting you on a return to school or return to work program, and guiding you back into sort of full-time work or full-time school in a way that doesn't exacerbate your symptoms, so you can get back and you can be symptom-free as soon as possible. In terms of driving, we also put you on a graded exposure plan to driving, because some people can get motion sickness following this. So we like to implement something like that. And then we start to put you on a return to play program. So what that looks like is we might start you on some light exercise and then get you booked in for a treadmill test. And the reason for this is that, as Clara explained, when you first get a concussion, your ATP, which is your energy, drops. And what we want to test is, can your body sustain an increase in demand for this ATP without producing your symptoms? So we get you on the treadmill, we get your heart rate up, get you working, get you pushing out some effort, and we see if that brings on your symptoms. From then, if you don't have any exacerbation of symptoms and you don't play any competitive sports or participate in any high-level sports or activities, we tend to discharge if you're having no further problems. If not, and you're a high-level athlete, we will then get you in for another, it's kind of like a high-level exercise testing regime, and it's the same thing. We put you through paces, do a lot of exertion work, and we retest some measures to see if we provoked any of your symptoms. If after those few interventions you're still getting symptoms, we start to look more into your neck and more into your vestibular system. So your neck is highly linked with your eyes, and basically a lot of the symptoms associated with concussion, like your headaches, dizziness, vertigo, neck pain, and that kind of thing, are also associated with your neck. So they can present very similarly, and that's why it's very important to check both. So then once we check your neck, if we tend to find anything that we need to treat, we will then treat it, give you some exercises, and from there we should see an improvement in your symptoms. If we don't find anything happening with the neck, we will also look at your vestibular system, which is your balance system located in your inner ear. It tells you where your head is in space, where your body is in space, and how you're moving and how your body needs to react to that movement or any external forces being pressed against you. So if we find an issue in that vestibular system, again, we will treat it, give you exercises, and hopefully from then your symptoms should dissipate. In the first appointment, we will also put you on a modified diet plan, and this is because of the inflammation that occurs due to concussion. So we need to get you eating foods that help to settle down this concussion and give you your best chance at recovering from this injury. So recovery from acute concussion is generally very good depending on what has happened and how you have sustained your injury. People tend to be fully recovered in their ATP levels, which is their body's energy, after about 30 days. So as long as we go through all of these protocols of clearing symptoms and causes of symptoms, we can generally get everyone back into play pretty quickly and pretty safely. The important thing to know is that we treat acute concussions within about a 1 to 10 day basis. Anything after 10 days, we tend to treat as a post-concussion syndrome, and this is because there might be some external factors that are affecting your recovery. So the treatment of post-concussion syndrome looks a lot like the acute concussion syndrome, but we will obviously discuss this more in the coming weeks. So the biggest thing to hit home is that concussion can happen without any loss of consciousness. It's very important to get into a clinic and get assessed as soon as possible so that we can get you started on a rehabilitation and prevent any recurrence or kind of longevity of symptoms. And we need to get you into some graded exercise, not just resting, to make sure that we can get you well on your way to recovery. If you have any questions about anything that we have talked about today, please leave us a comment down below and we will get back to you. Thank you, guys.